Next item on the agenda is our weekly COVID update with Dr. Folsom.
Thank you very much.
Hello.
That's a hard bill to follow.
Yeah.
All right.
You'll be fine.
Yeah. Oh, yeah. I'm not sure if the updated slides got here, but okay. Very good. And the little thing here. Okay. So as per routine, we'll go through our typical slides here. So the Calvert County COVID case rate has gone down yet again. For the first time in several months, we reached under 100 cases for the past week, which was fantastic. And as you remember, this runs Wednesday to Wednesday. That's our data collection typically. So you can see here that our positivity rate has now reached almost that elusive 5% mark that the CDC sort of sets for low transmission rates in the community, which is fantastic. If you look at the age distribution of cases, you can see once again that our over 65 population really has minimal illness burden at this point in time. We do have, I'll get to this later, but for hospitalization, there are some over 65. But you can see that there has been an increase in our 36 to 55-year-old age group, which is generally the hardest ones to sort of convince for vaccination as well. So we can see that has gone up. Thankfully, our children, our youth have continued to go down in terms of their case rate as well.
I think that's gone down, Doc, because you're here. That's just my personal thing. I'm just making, it just seems funny coincidence you're here and all of a sudden the rates are down. So,
you want to send Dr. Polsky something?
Yeah, just observation.
Chair would entertain a motion.
You can see here, these are the total number of tests run. 1,935 tests were run last week with 99 positives, and you can see our positivity rate of 5.1%. Statewide COVID numbers have gone down yet again. They mentioned that in our local health officer call yesterday. So unlike 100 deaths about last week, there's 71 deaths for the last week in the state of Maryland. You can see that the current hospitalizations and ICU admissions are also down statewide. I'll just briefly touch upon, I forgot to put the slide in, but currently we have one ICU patient at our local hospital. We actually have one COVID positive patient on labor and delivery and 4 ward patients. So those are our current census as of yesterday. Here's our vaccination summary. So this is using our total population, which, as we know, our total population includes those who are not yet eligible to be vaccinated. So on this slide, you can see that with the current population, we have about 35% of our residents vaccinated. But if you go to the 65 and over vaccine summary, you can see that basically we've got almost 80% of our 65 and over community fully vaccinated. This is our 16 and over vaccine summary. So this does include those people who are eligible for Pfizer vaccination at this point. And that shows that the vaccination rate's at about 44% for all of those age groups combined.
Doctor, with the Pfizer being approved for
Yes.
the younger children.
Yes, yeah. I actually added this slide in first thing this morning because, of course, they came out with the recommendation yesterday after I had gotten the slides to Rachel. But they did come out yesterday. The FDA approved vaccination for 12 to 15-year-olds. It does need to go through one more hurdle, which is the Advisory Committee on Immunization Practices. They're having a meeting tomorrow. It will actually be a live meeting that anyone can watch. So there's no registration required if people want to watch them discuss the vaccination. They enrolled in this study for Pfizer. They enrolled a little over 2,000 children 12 to 15 years of age. They randomized them to vaccine or placebo. The placebo cases had about, I think, 16 to 17 cases after they were vaccinated, whereas the group that had been vaccinated had 0 cases of COVID after they were vaccinated. So shows very good efficacy rate. Similar side effects to adults: fever, headaches, body aches, chills, generally lasting 1 to 3 days total. If you see longer side effects than that, that usually brings up something else. So most people should see their doctor if that's happening. So we have vaccinated 460 teenagers in the school system. The partnership with the hospital, a big shout out to Kara Harrer, who's the pharmacist over at the hospital, helping to coordinate that and the school system. And we got those done last week. Their second dose will come the week of May 24th, I believe it is. So they should be fully vaccinated by the time they graduate and go on to their summer activities. And then we will be coordinating getting links out. Unlike for the teenage age group, we are likely going to send links out through the school system, but for those parents to bring the kids through our drive-through. So unlike the school system vaccine clinics that we had actually on the premises of the high school, we've chosen that because the parents have to come through anyways and drive their kids through anyways, it's a better option for us to use our drive-through capabilities, and the school system agreed with that. As did several local pediatricians. I actually polled them this weekend to see, what their recommendations would be, and it sounds like most of them at this point still would be happy to send their patients through our drive-through, just based on the organizational level and everything. We do have ample supply, so as soon as we get the green light from the ICIP meeting tomorrow, then MDH gives us the green light. PrepMod, which is the platform, the technology platform that we're required to use, will make a switch and will allow 12 to 15-year-olds to be able to be registered. Currently, it is required that they're 16 and over, and they can't even get past that point, so if they're under that age. So easy switch for technology. And just again, these are all the local and mass vaccination sites. Doctors' offices do not currently have Pfizer vaccination at all. We will work with them in the future if the temperature requirements do change in terms of storage so that they can get those vaccines in their offices. The other thing that the ACIP will hopefully address tomorrow is co-administration with other vaccines. For most adults, we don't have to worry about that. We're not getting vaccinated every year, every couple years. For children, when they go for their well visits, they're generally trying to get some vaccines in, right? So you might need a tetanus booster, or you might need a meningitis vaccine. So the ACIP should hopefully go into that detail. Are we going to need to space them out? Are we going to be able to sort of co-administer them with other vaccines at the well visits? And then just again, our vaccine registration information, really everything is public at this point. So if you go to calvertcountycovid19.com, you can see all of our clinics that are planned for the next couple weeks, and you can click on whichever one makes the most sense for you, coming through time-wise, date-wise, et cetera. We have had a discussion internally about making them no registration required, which means you can just literally drive up and get your vaccine. We are not there yet. Most of that is because of technological issues, but we're in discussions about that so that people can just pull up and get vaccinated.
So what is the technology issue for that?
So the links have to be, you have to sign up through the computer in order to go to Immunet. So Immunet is the database that houses all of the information. And right now, it's a very difficult option to do something like that on site. So you can imagine that there could be backups, there could be delays if people pull up and then they have to register on site. So we're trying to figure out logistically how that would work. Would we pull people up and have them park in one area, register, and then come through, that kind of thing?
Because all the mass vax sites are all doing walk-ups.
Yes,
So they figured out somehow to do it.
Yeah,
so.
and I think with our space, with our configuration over there, we certainly can. I don't think there's a lack of space in order to do it. We just have to figure out what way to do it. We might have one drive-through for registration and then weave people back through, something like that. So it's just logistical stuff.
Doctor, with regards to the Pfizer, do we have the capability needed to hold that based on volume that's coming because of its unique temperature requirements?
Yes, yeah. So the hospital actually houses all of the Pfizer vaccine coming in the county. So we have a partnership with them. They keep it in the ultra low storage, ultra low freezer temperatures. And so we pull it out when we're getting very close to a Pfizer clinic. Kara Hara, the pharmacist over there, is wonderful at keeping track of those very specific details. And so then when we're having a clinic, she pulls them out, we use them. We try not to waste any doses. So that is our biggest effort here in this county, is that we try to coordinate so that there's not going to be any wastage. And that's really the way that things have been going. If the ACIP also allows for lower standards for temperature storage, then we might be able to facilitate getting it, like I said, into pediatricians' offices or family doctors' offices where they can sort of have it for a couple weeks in regular freezer storage. So.
Okay, thank you.
Yep.
So I noticed over the weekend a pop-up testing site in Giant Shopping Center in Prince Frederick.
Yes. So for
Did I
COVID,
just notice that, or has that been there a while? And how does that work?
The state has offered, and we can't reject it, pop-up testing sites. So there's going to be one this week here, and then there's going to be one up in the beach area. Those are run by the state, and those are just testing options that people can have.
So you just drive up and get a test.
Apparently. So there's no specific guidelines that we know of that they are requiring in terms of like symptomatic versus not symptomatic. I will remind everyone that if they have a provider in this community, all of the providers have been have rapid testing capabilities, and PCR testing has not been an issue since the very early days of COVID. So we have ample supply for testing. Doctors can send that off. The turnaround time generally these days is about 2 days, so you can get your results back pretty quickly.
So we have to get the CMR to help get the message out that those sites and times
Sure.
when they can drive up.
Yeah, we can put that out there for sure.
I know from recent experience, the testing sites drive in, no appointment, test, and get your results in 15 minutes.
Yes. Yeah, and the one here in Prince Frederick Urgent Care has been running, seamlessly basically this entire time for rapid testing, which is wonderful. You do have to pre-register for those. So I don't know the specifics about the one that the state's running, but I can look into that.
But you have to have some symptoms to do urgent care, don't you? No?
You don't, no.
Okay.
You can do it for, if you're going for a colonoscopy, if you're going to travel, you can get the test done for really any reason. Yeah, if you've been around someone who is, positive. So, yeah.
Well, hopefully the governor of Virginia announced that if the trends stay the same, June 15th, all restrictions will be lifted. And yesterday, the mayor of D.C. said June 11th. So
Okay.
we're hoping Hogan will be out soon with a
Yes.
date that we
Yes.
can all look forward to.
Yes, and similarly, we discussed that at the local health officer call as well.
Yeah.
So we're hoping, fingers crossed, if it stays this way, that's a great sign of things to come.
Get life back to normal.
Yeah.
Whatever
bumper
the
sticker.
new normal's gonna be. Right?
The bumper sticker is we need to make one, right?
Yeah, I told you we need shirts.
Shirts. Mike's been pushing shirts for weeks now.
I have a Cricut machine, but I don't
There you
know that you really want me to go to town using that thing.
We can start a partnership here.
Yeah, there you go. All
So
right.
next week, we're going to have
Hashtag
Dr. Polsky back with us.
I believe so, unless he says no, I bow out. But no, I
Well,
think he'll be back.
If the numbers aren't going down, he better stay away.
Then he's on the hook.
Right, because every week you've been here, the numbers have been going down. So if there's
Very
some
good.
change in trend, we're gonna.
Very good.
Yeah.
I hope not. Yeah. All right. Well, thank you very
Thank
much,
you.
gentlemen. I
Yeah.
appreciate it.
Have a
Thank
great
you.
day.
You too. Thank you.